Welcome back, loves. Today, we're going to be talking about how you can make your therapy sessions more impactful. And this is the last episode in season 2 of the Anxiety and Free podcast. Part of me can't believe that I made it through season 2, especially with all of the life changes I've had that I've shared with you in previous episodes. So, this is something for me to celebrate today and moving forward, especially as we move into season 3. I'm going to tell you more about what you can expect in season 3 at the end. However, today I want to talk to you about really making those therapy sessions mean something, how you can make the information you learn and practice in therapy actually stick for you because you deserve for it to stick. You deserve to be able to carry those skills throughout a lifetime. Now, first, I'm going to share something personal with you, a little personal story. So I hope that you hang out for that. Oftentimes have these experiences in my personal and professional life that just remind me of therapy. And when I say in my professional life, I mean I can be outside of a therapy session having a therapeutic experience or at a networking event or, just hanging around other entrepreneurs and something dawns on me. So this week, something dawned on me because I was having these unexplainable symptoms that started to escalate and I could not understand where they were coming from. Now, back in Tampa, I had different procedures to kind of rule things out and everything was cleared. I'm telling you, it was 2 months of a lot of medical appointments just to try to see if everything was okay. So thank God I'm good, right? And then all of this stuff started happening and I had no clue what was going on. So I'm going to tell you the experience and I'm going to keep it short for you because I know attention spans are shorter these days for people. I really think you'll want to stick out for this so that you can hear how this ties into the therapy experience though, because I think it's a good crossover because it deals with medical care and then non-medical care, which is non-medical counseling or psychotherapy. We use those words interchangeably. And I think you'll see the connection. Okay, let's dive in. I was having symptoms of numbing and tingling in my body. Started in my feet, moved its way up to my hands, and my blood pressure got really high last week. And we have several blood pressure cuffs at home. My husband and I are in our 40s, so we're just we try to stay on top of our health. So I noticed that I was feeling off. Okay, I kept running to the back door in the house and going outside like I can't catch my breath. I need some air. And, the kids would be talking to me and I'd say, well, mommy needs to pause, need a timeout. I need to go outside. And it was seeming kind of odd. And then I'm having this numbness and tingling that was worse at night, most likely because during the day I'm just so busy. Who can really pay attention to the symptoms unless they're just bold? They weren't bold. These were very mild symptoms. But if you are a person who stays in tune with your body, you're aware, then you know when something's off, even slightly. So this was off so slightly that it took me days to even go to urgent care because I thought, well, I do have plantar fasciitis in my feet. We've been doing more walking in the woods, me and the kids. So maybe that's what's going on. Maybe that, pain from my feet is just kind of traveling up. I was doing a lot of research online and then finally I prayed and I said, God, should I go into urgent care? Because at this point, it's mild. However, it's getting worse, even though it's mild. And the download I got back from God was that, yes, you should. So I went to urgent care. They couldn't figure it out. They sent me to the ER. I went to the ER. And this is where the part that connects to therapy starts to come in. So I'll tell you what happened and then I'll tell you how it really connects to psychotherapy. You know that I have OCD, okay? I've shared that already. My OCD is my superpower. Historically, when I was a child, when I was in undergrad, and even in my early 20s, it was my worst enemy. It was horrible for me to have the experience of living in a body with a brain that has OCD. I have learned over the years how to use OCD as my superpower. Now, some people might think this is too much, but I have a medical history document in Google Docs. I keep tabs on my mental health. So I kept a blood pressure log. I kept a symptom log alongside the blood pressure log so that when I reported to the medical professionals, hey, my blood pressure was high on this day at this time, and these were the symptoms. It was numbness and tingling, or I felt short of breath. So I keep a lot of detailed information. I still have receipts from payments that I made for different things, different hospitals from my early 20s. Yes, I'm 42. Don't judge me, okay? I have it though, and that's part of OCD that has proven to serve me well in life. Like literally years later after I made a payment to Boulder Community Hospital, they came back and said I did not make a payment, and I had the receipt. And when I say this was years later, I mean like 4 or 5 years later. They tried they put it on my credit report, and I was like, "Oh, no. I have OCD, honey. I have a receipt for that. I have a receipt for everything," okay? I digress. So, I'm at the hospital. I have not only the discharge paperwork from the urgent care, which they didn't initially want, the nurse who checked me in, but the doctor looked at it. And then I had my medical history and I have it all documented. Anytime something happens in the family, I add it to the medical history document. I'm on top of that because you just never know what's going to happen to you throughout your life. So you might as well keep up with that stuff, right? Things run in the family. I had, my blood pressure log, all the things that I've shared with you, I brought it all. So by the time I actually met with the doctor said, "Okay, I'm going to narrow this down. We're going to do, um, you know, we're going to do a process of elimination, basically." I won't use the medical term for that, but I'll use just say it was a process of elimination, just because I don't want to lose anyone on this episode. And he was like, "I don't think it's this. I don't think it's that." And even at urgent care, they said, "I like to have a collaborative process. If you don't want to go to the ER, what are you willing to do?" So, by the time I'm talking to this doctor, it's a collaborative effort. It's, yes, he's the medical doctor. And I was there for like 5 or 6 hours, y'all. So I met with two different nurses, two different doctors, and each one met me with a smile. Each one had a, strong intention to help. Sometimes you can feel dismissed going into those spaces. And I didn't feel dismissed. And I came prepared. I said, "Oh, I have my EKG report from urgent care." And he was like, well, because he said, I don't know the concern about your heart that they shared because I hear that you're telling me you had testing on your heart back in June of this year, but I don't have an EKG to look to see where your heart is currently. I said, "Oh, I brought a copy from urgent care a few hours ago," right? So he looks at that. He's like, "Yeah, I'm not concerned about this. This can be normal when people are under stress or, when the blood pressure's up, blah, 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 all these things." So long story short, and I'm going to tell you the diagnosis at the end so you can stick around, right? I want you to stick around. He narrowed it down. He said, "I want to do some blood work." He said, "This could be a sugar related issue. This could be some sort of vitamin deficiency." He's like, "I don't think it's MS. I don't think it's this. I don't think it's that." He's like, "I think if it were one of those more severe diagnoses, then you would have other symptoms. You would have chest pains. You would feel like you're about to faint. You would be losing complete loss of the side of one of your body. You would have trouble speaking." He was like, "You don't seem anxious. You seem very calm. You don't have any confusion. You're talking to me very clearly. You passed your neurological exam." Yeah. He said, "You passed that with flying colors. So I don't think it's any one of these, but I do have some suspicions about what it can be." Now, it took about 2 hours for them to get me the blood work back and come in. But here's what I started to think. How does this relate to therapy and the experience of people going to see a new therapist? When you go to see a new doctor, or especially like, we're in Maine now. So all of the dentists that we're trying to see are saying, "We need the paperwork from your previous provider." Even the medical providers, "Hey, when you get in, I'm just letting you know, we'll need you to fill out the intake paperwork. And if you can, it's best if you bring the paperwork from your previous provider so that we can provide the best care for you." When people go and see a new therapist, they typically bring zero documentation unless they're in some sort of system. And if they're in a community mental health system, then of course that new paperwork would be just automatically provided to the new provider once they're assigned. And if you're outside of that, I'm in private practice, I work for myself, people come to me and they don't bring paperwork. Now, what I'm about to say, I don't want you to take as something that will deter you from seeking therapy. In fact, I want to actually empower you to go to therapy and get your needs met even better by providing some of these things if you can, if you feel comfortable. So typically when people go and see a private provider, and even if they go into community mental health, they're not providing previous documentation. I have been doing this for 15 years. And over the course of my career, I have worked with people and then they finally start opening up about things. And I'm like, "This sounds like ADHD. This sounds like OCD. This sounds like bipolar disorder." And then out it comes where people will say, "Yeah, I was diagnosed with that when I was a kid." And I'm thinking, why didn't they tell me? Did they not feel safe enough to tell me? Right. And sometimes I do think it is that people have to take their time to feel comfortable opening up about certain diagnoses. And I get that. Even coming out online and saying I have a diagnosis of OCD, I've had it since I was about 7, that can put a target on your back, and the stigma is still real. People can judge you. When it comes to working with a professional, though, it is important that we come and share any information we have about our mental health. I'm just going to speak about mental health right now because that's my lane. My lane is not medical. I'm not a nurse. I'm not a medical doctor. I'm a psychotherapist. So, I will find out years later that people had a certain diagnosis as a child. And, when I'll gently kind of poke around and try to understand, what took them so long to tell me, sometimes it's embarrassment. Sometimes it's, I didn't believe it. My parents didn't believe it at the time. And I wanted to see if you would pick up on it, right? I've heard that over the years. I wanted to see if you would pick up on it. And the answer to that is, I will eventually. Only when the symptoms show up, though. Only when you start to tell a therapist certain symptoms and experiences that align with a certain diagnosis. Now, I know that some therapists try to rule out everything. I think that's completely overwhelming for people. I try to deal with the low-hanging fruit. What are the symptoms right now? That's the low-hanging fruit for me. Let's go towards that first. You may be going through a divorce, you may have lost your job, you may have just lost a loved one and be dealing with a lot of grief. What is the low-hanging fruit? What's presenting at this moment? And that's where we start because we got to put that fire out first before we move forward, right? So, what I'm saying is, if there is any information that you can provide your therapist with about your mental health history, we will take it. I don't know about other therapists that you've worked with. I have had people who've provided me a summary from their previous therapist, and that's most likely what you're going to get. So I want to touch base on that too, because not a lot of therapists want to automatically just give you all of your records. We're keeping notes. We should be, okay? We should be keeping our clinical notes. We should be updating your treatment plan regularly and or as needed based on your individual circumstances. And I have heard the stories and I've seen in therapist groups where therapists will say, "Hey, my client's asking for their records." And other therapists say, "Well, it's theirs. Legally, they are your records, right? I'm just the holder of them for 7 years." So you have every right to them. What most therapists that I know will tell you if you ask for your records is, "Hey, it might be better for me to provide a summary because, I want to keep your records very safe and very private. If you want them, I will absolutely give them to you. There may be things in your record that might be upsetting to you based on where you are now versus where you were 2 years ago when you met with me. And I'm not sure that it would not be traumatizing for you to have access to those records and read through all of it. That's just the reality of it, right? If we're keeping accurate records, we're putting in what we need to put in to document the session and protect you at the same time. And at the same time, if you had a traumatic experience, use your imagination 3 years ago, and your therapist has documented about that on your behalf, well, that could be re-traumatizing for you. So it might be in your best interest to have a summary of your session and your diagnosis, clinical findings sent to the new therapist, okay? Even with that, that's helpful. I honestly don't have time to read every single progress note from your last therapist if you've been meeting with a therapist for 5 years and then you move states and then now you're seeing me, right? I don't have that kind of time to go read through all of those progress notes. However, I would want to see a treatment plan. I would want to see a psychosocial, which tells me a bit about your medical history, and it's not in depth, right? Because we're not medical providers, but what did you come to counseling for at that time? What were the goals? What were the targets? What were the main symptoms? What was the initial impression of the clinician? What was the diagnosis? What were the things at that time you were doing for self-care? Who was your support system at that time? On that form, did you report that you ever had an inpatient hospitalization for psychiatric reasons? I need to know that. On that form, did you report 3 years ago that you had suicidal ideation or that you had a previous attempt? I need to know that because I need to know these things are in your history. These are the things I should be looking out for, the things I should check in about, right? This is not a perfect process, okay? Everyone comes to us as a new, unique individual. And at least in my practice, I'm integrative and I want to understand face value who you are. And if I have history about who you are, gosh, how much better is your treatment going to get because I know what you were dealing with previously. Maybe you were previously diagnosed with generalized anxiety disorder and it was actually something else, or now you're actually in remission and your therapist never told you, oh, you've been doing really good. Like there's a lot of progress. You actually no longer really qualify for the full diagnosis of that. Or maybe you had some psychosis in your past where you were seeing and hearing and experiencing things that other people don't see, hear, and experience. And you never told me that, right? And now you just had a baby and that's coming back up, right? Those symptoms are popping back up. And I'm thinking, oh my gosh, is this postpartum psychosis? No. Now that I have your paperwork, I know that you had a previous diagnosis where psychosis was at play. Okay. So these things are so important so that you can get the best treatment. And I know that people don't put certain things on certain pieces of paperwork. And I'm honest with people. Look, I don't always put out everything. Okay. If it's something that I know will be documented by an insurance company, which is why I don't for my personal therapy or my family's, anyone in my family who receives therapy personally, we do not go through insurance. I don't want that diagnosis following anyone. Okay. That's my personal opinion. I understand that insurance is necessary, access is necessary, and a lot of people want to use their insurance. I'm telling you, we have sacrificed and paid out of pocket because I understand the impact of that. Okay. And I can say more about that in another episode. I don't want to do a deep dive into that. What I'm saying though is that some people leave things off of their intake paperwork because they're scared to tell me. And sometimes they'll say, I didn't put that on the paperwork and I'm telling you directly because I didn't know if that's something that could get me in trouble, you know? If we think about certain types of substance use, recreational use, that's what I'm referring to. Don't be thinking people are telling me things that I need to report, okay? I report the things that need to be reported. I am a mandated reporter everywhere I go, okay? Just a little side note for you all. So it's your business to tell. What I'm saying is that when you come to a professional, please think about what preparation looks like for you. Please think about what collaborative care looks like for you if you want your previous therapist to talk to your new therapist. If you want your new therapist to also communicate with your medication prescriber, because we can do that. That's a collaborative care model, okay? And please think about what happens if you leave certain things out of the puzzle. And by puzzle, I mean you come to me as a new person and you tell me, Marquita, I have these issues. I'm thinking, what's the missing piece? Okay, here are the symptoms. What's the missing piece? And the missing piece is often there are certain things that are not being done in your life that you could start doing to fill out that puzzle more, right? There are certain connections that you need that could help you fill out that puzzle more. Regular therapy will help you fill out that puzzle more. Me understanding what your historical diagnoses were will help me fill out the puzzle because now I can actually focus more on the here and now. And I'm not doing so much thinking about what's missing, right? Something's missing here from the story that the person's telling me. There's like three puzzle pieces that are missing from the actual story. And I am very insightful and my discernment is on point. So I know when people aren't telling me the full story. Okay. Trust me. 15 years again. I know when something's missing. I just can't always pinpoint what's missing. And again, if the thing that's missing, those three pieces, don't come up until 3 years later, now we have spent 3 years and there is delayed progress in a specific area where you could have had a breakthrough. And that is my entire goal for you. If you're working with me, I want you to have your therapeutic breakthrough. I want you to have those aha moments. I want you to look at me and say, this is the best I have ever felt in my life. Why did I wait to do therapy? I want you to get to the point, if it's your goal, where you say, you know what? I'm going to talk to my doctor about getting off medication. I think I'm ready. I'm in a good place. I'm doing all the work. The medications helped me get this far. I don't want to be on it for the rest of my life. I'm ready to try life without medication. I want you to get to that point so that you can have freedom with your mental health. It's the whole reason I named this podcast Anxiety and Free. It's not just about anxiety, because we have anxieties about a lot of different things in life, right? It's about the freedom that you can gain when you have clarity, when your mental health is in check, when you're also taking care of your physical health, when your spiritual health is on point, when you've learned why your financial habits have been off, because there was some trauma in your past with that. So we work through that. When you start to trust yourself again, to make the right decisions for yourself. So you're not looping and cycling in and out of negative relationships and in and out of negative cycles and behavioral patterns. That is what I want from you. And no, I'm not reading from a script. I'm speaking from the heart. That is truly what I want for you, if you're listening, and for every person that I work with. And I've wanted it for myself so much that I've done the hard work to achieve it. And I have. And it's not a perfect process. You'll have things pop up in life and they will threaten to take your sanity, okay? But you'll have the tools and the skills. So, anyways, I'm encouraging you to keep a list, keep a log, keep some documentation somewhere. Even if you don't want to provide your new psychotherapist with direct information from your previous provider, keep your own log. Give your own summary. These are the things I've worked with in therapy previously. I've had people do that. They give me like a 4-page letter. That's what we joke. I say, "Oh, you gave me a 4-page letter." And I read it because I want to know who you were before you showed up in my virtual office and occasionally physical office, very few times a year. I hope this part has been helpful, just talking about my own experience. And let me know too in the comment section if you want more stories like this. Now I'm going to tell you what I was diagnosed with. I was diagnosed with a vitamin B12 deficiency. So when my labs came back, the nurse came in at that point and she said, "Are you vegetarian or vegan?" And I had a look like, "Oh, what is she about to tell me? What's deficient now?" And I said, "Yes, I'm vegetarian for what was it? For 2 to 3 months recently. I tried out veganism. This was right before we left Tampa. So I tried it out I was having some symptoms with dairy and I decided to do veganism for 2 months. So then now we're in Maine. I'm no longer vegan. I'm vegetarian again, right? So vegan was fun, but I just had to go back to vegetarianism because I just was not getting enough. And clearly, I was in the ER with numbness, tingling, headaches because I was not getting enough B12. So now I am on a B12 supplement. Thank God it is nothing severe. Thank God it is something that is treatable. I am feeling better. The numbness and tingling is not completely gone, not 100%, but I would say it's about 85 to 90% gone. So I'm feeling much better. My energy is back. I'm resting more. So I'm very, very grateful for that. And so if you're vegetarian or vegan, please make sure you're talking to your medical provider about what supplements you need, okay? Because I was not. We were just always talking about my blood sugar, keeping that under control. And I was managing that through diet and exercise, okay? But now I know it's on my radar. So I will continue to take my B12 supplement. I had also, by the way, stopped taking my daily iron and multivitamin when we moved here. And I think we've been here like 6 weeks now in Maine. So that was another issue. So I think that's where I was getting a little bit of my B12, but I hadn't taken that in months consistently. So there's that. I don't want you to end up in the ER over anything, especially not a B12 deficiency. Okay. It's something that's manageable. So what do I want to say to you now? I hope that this has been helpful. I think that we need to change the way we approach therapy. Psychotherapy is serious. It is needed. This field is going nowhere anytime soon. Okay. We are a part of your full healthcare. Okay. We are a part of it. We're not the full part of it, but we are a part of it. And as providers, healthcare providers, we deserve to know the information that will help our clients achieve their goals. And you can share that information based on how you'd like. Again, getting your recent records or creating your own summary. However, we want to help you, and we can best help you when you help yourself and bring the information forward that will help us fully assess and fully treat, right? Fully treat whatever symptoms are coming up and help you achieve your results faster. It only gets better when we have more information, right? You can't go wrong there. Unless you have a provider who's unethical, but that's a whole nother episode. So what's next in season 3? I am glad that I ended this season with this episode because I think this is something that needs to be said in the therapy field. Moving forward, I am going to try out not having a theme. I am not really It's interesting because a person like myself who has OCD, historically, it was very black or white. It had to be themed, a theme podcast, or, you know, unthemed. But really, it needed to be themed to give me structure. And I have really entered this phase with my relationship with OCD where I just want more flexibility and I'm going to give myself that because to me, that symbolizes the growth for myself. Because historically, I would pigeonhole myself into one lane. Okay. So I can't tell you what I'm going to talk about in season 3. I can tell you that I'm going to show up authentically and I'm still going to do minimal editing moving forward because I want you to get a sense of who I really am as a person and as a provider. I'm still going to be inviting guests. I have 2 people who reached out to me who have said, "Hey, can I still get on your podcast? I'm sorry I haven't filled out the form." And I said, "Absolutely. Just let me get settled in Maine." Okay. And then I've met some people along the way here in Maine that I want to invite onto the podcast to speak about the different topic in their niches. I want to invite more people to talk about different things. I don't want it to just be me. It was never created for me to just talk on the podcast. Life got busy, life got stressful. We had to move and I had to not invite people for a while so I could really get a handle on this, okay? So anyway, season 3, it's not going to have a theme. I'm just going to talk to you. I can't tell you how long the episodes will be. They've been averaging around 15 minutes or so. This one's approaching 30, so you got a good chunk to help you through your day or your drive if you have a long commute to work. So, as I always end, I want to know if you will consider trying therapy. Okay. This is all about empowering you to consider therapy as an option in your healthcare journey. So, please let me know in the comment section what you thought about this episode, any feedback you have. Let me know if you had a vitamin B12 deficiency too. And also let me know if this episode or any of them on the Anxiety and Free podcast have inspired you to look up a therapist, do a consultation, actually get started, give it a try. Because I know that therapy is life changing. It has been for me and for so many others. And I want that freedom for you too. Until next time, enjoy. The Anxiety and Free podcast is sponsored by Find My Therapist, connecting you with therapists at findmytherapist.us. If you found today's episode helpful, please share it with someone who might need it. Tune in next week for more conversations on navigating mental health and finding your freedom.